First thing we're going to talk about is heart attack. There are some signs and symptoms of heart attacks that we see on movies typically, but that's not true in all people, and I want you to understand that. Usually with a heart attack, by the time the person comes into us, if we can save them, they have been having the chest pain for 2 hours. Women, you're much different. You know, women back in the 70s and 80s and early 90s, we lost many of you. Many of you died from a heart attack, not even realizing our symptoms are different. So we're just going to spend a couple of minutes on that. You can read the statistics here. What EHAC is means early heart attack care, and that's just what we're teaching you. So that you take an oath for yourself, for your family, for your neighbor. If somebody comes, if you're walking down in the mall, at the movies, and you see some signs and symptoms, that you can go ahead and call 911. Main thing there is to call 911. Heart attack here. Men, you guys usually do have the standard movie type. Chest pain, pain down the arm, pain on the jaw, very diaphoretic. Diaphoretic is very sweaty, like something's heavy. You have that heaviness elephant on your chest. A lot of times men will come in and they'll have this pain for a couple hours before we can save them. As I said, if you start having these symptoms, I'd rather have you call 911 early, come in, let us do an EKG and say fake. Because if we think that you really are having a heart attack, what certain hospitals do, and we being one of them, because we are a STEMI receiving center, which means it's a cath lab. And I'm sure you've had some friends who have gone to cath lab so that they can end up living. Main thing, we're opening up all of the arteries in the heart. So at that point, when we know from 911 that somebody's coming in with chest pain, we call our cath lab. We'll call them at 2 o'clock in the morning, and then they have to come back at 4 o'clock in the morning if it's fake, and they'll come back at 6 o'clock in the morning. They don't care. We would rather save lives. So we'd rather have you guys go ahead and call and say, oh, it's a false alarm. Real quick, women, when we have our heart attack symptoms, ours are totally different. We tend to feel that we're getting flu-like symptoms. We have, so a lot of you guys are going to go home and think, oh my gosh, I'm having a heart attack. Okay? Don't do that. Okay, I'm just saying. Okay, so tonight we're going to call them and go, did you talk? Because we had 37 people call. No. You have a pain in your shoulders sometimes. And women, we tend to carry a lot of our stress already in our shoulders, so we really can't tell. We tend to have heavy shoulders and we're like, oh, we just feel like we're getting flu-like symptoms. You know when you're achy all over and your body kind of aches, almost every bone, every joint aches, and you're going, oh, it's just achy, flu-like. Then you're a little nauseated too. Maybe it's a 24-hour bug. That's why women wait for a day or two. And it's not going away, and now they have the full-blown MI, and then we can't save them. Again, one more with diabetics. Diabetics, if they have neuropathy, they do not have the same pain as a man presenting with heart attacks and as the woman presenting with heart attacks. They may just say something like, I just don't feel well. Something's wrong with me. I can't tell you. I just don't feel well. Then a lot of times we'll say, take your blood sugar, and at that point we'll call 911. For the men, it's not, for a diabetic man, it's not the elephant on the chest. There's not the jaw pain. There's not the pain radiating down the arm. Diabetics don't feel that. Ours are more like flu-like symptoms. We'll carry a lot of pain in our shoulders, and we feel like, have you ever felt like when you've had a flu, not really a common cold, but a flu, and every bone aches? You usually get in bed and you're almost in the fetal position because every bone aches. That's what we feel like. That's what they say. Women, no, we don't have a fever. We have the generalized achy, almost fetal position, as I said, but we're very nauseated. So a lot of times, like I said, we think it's a 24-hour bug. We might even have some slight emesis throwing up. So that's why we kind of still relate it. I think it's just a 24-hour bug. I think it's something I ate. I caught something. That's why a lot of times we leave it for 24 hours before we go, oh, and it was really had. Because whenever your heart muscle doesn't, we can't bring it back. If it's dead, it's gone. And we can't bring that back. That's why we wait a couple, 24 hours, 48 hours, and then we've lost a lot of heart muscle. And we can't save you. That's mainly, most women, I very rarely maybe have one in every 50, 75 women that will have men-type symptoms. All of the paramedics have their EKG machine, their defibrillator, now it's not in the ambulance, but it's in the paramedics. and they will go ahead and do a 12-lead EKG right then and there. They'll put the 3 leads on, and we can tell when we talk about a 12-lead EKG, it means we're putting 12 leads on you. If we do a 3-lead, we put 3 leads on you, 5 leads. All that is looking at, to help in layman's terms, let's say I found this thing called a heart. Ooh, and I found it in some other country. I boxed it up because I wanted to bring it home, and I put it in a wooden box. And I'm like, oh, I can't see it now. So I drilled a couple of holes up at the top, and you would look down at the heart on the top. I drilled a couple of holes on the right side, and some of us are looking at the heart on the right side. Drilled a couple of holes on the bottom. I'm looking at it. So we're looking at the heart all in different places, different ways. You see it a little different than I see it. That's what a 12-lead EKG is. It's showing me different views, different sides of the heart at all times is what that's showing me. Okay. And then and so we'll do that. The paramedics will do that 12-lead EKG right then and there. And from that, we can see what we call an ST elevation. And we can see if the ST elevation is right away. And we know, yay, that sounds bad, yay, that's good heart muscle, go right now, we can come and get you. And we can sometimes see a ST elevation that's a little different that we can tell it's already dead muscle. And so we can tell, sometimes we can look, if I hope never has happened to you, the doctors looked at the EKG and has said, you've had a heart attack before. And you're like, oh, I didn't know that. Somewhere along the way, you've lost heart muscle that you didn't know. So we can tell by looking at an EKG if it's new, old, or what. So that's what I just want to relate to you, that this is a campaign to educate everyone. Now you guys are going to go forward to present the information. And it is a plea to you to work with the community to save more lives. That's what we want.